Welcome to the BioAlabama Faces of Science series, where we, the BioAlabama interns, chat with bioscience professionals about their journeys from academia to their careers. I'm Brooke Bailey, and today I'm talking with Dr. Ashley Lindsay, a professor of biology at the University of Mobile.
Can you please state your name, the current title of your role, and where you work?
Yeah, so I'm Ashley Lindsay, and I'm a assistant professor of biology at the University of Mobile.
And what does your normal workday look like?
Well, we are a pretty small institution with a small natural sciences department. So whereas a normal course load for a undergrad professor is typically 12 to 15 hours. We teach 20 to 24 hours a semester, so about double. So my typical workday is really spent, the majority of it is spent lecturing. And then when I'm not lecturing or in a laboratory, I am mentoring students. So I have, because we also have advising roles. So I have students coming in right now. Most days are taken up with internship applications. So everybody's wanting to turn that in for the summer right now. So I have met with someone almost every day for the past at least 3 weeks about building resumes and applications for internships.
And how did you find yourself in this role?
So for teaching, I guess that's a loaded question. So, because you have to go through, I guess, my whole career up to date to say how I found myself back in academia. So academia was not in my brain where I wanted to be. I was actually interested in science industry and policy. That was just where I felt led. And so my PhD is in animal model development and vaccine and therapeutic development. So very industry forward. and I have completed 2 postdocs, both in similar roles, one being in therapeutic development, animal model and therapeutic development for cancer treatment. And then one for vaccine development for infectious disease models. So I thought, okay, I want to do either industry, pharma, biotech, or work somewhere with like policy, like with compliance, maybe CDC or something like that, because I did a lot of like BSL-3 select agent work. So I had thought, maybe that's the role for me, because I enjoyed it. I actually really I'm the type of person that really enjoys paperwork, as I guess you would have to be like compliance and
Makes one of us.
Yes, or in that role. But it gives me a good, satisfaction, organization. But then, so I kind of transitioned after my second postdoc into a role. I was the marketing and licensing associate for all innovations coming out of research, because I had done innovation studies for so long, and I had worked with a bunch of my peers commercializing and using these in I guess the science market. And so I really enjoyed talking shop through multiple disciplines. And I found myself marketing and licensing in getting these innovations into the commercial market. And these were not just in health or science or health science, but also in engineering. And it was very interesting to me. And then I kind of realized that I really just liked being I guess, quote unquote, cheerleader for people and for ideas. I really enjoyed talking to people about their career goals, about their innovation goals, and about development of ideas. So I still am involved in that with South, but I can be involved in that. It kind of brought me back to academia, that I get to be involved in that on a personal level with students. And that's what brought me into small academia, which I really appreciate, because I never have a class, even though I teach a lot of hours, I never have a class that's over 60 students. So I still get to really, and I mean, you coming from a really large school, I'm sure that can be shocking as well, but it really brings that focus onto mentorship, which I really appreciated. So I can have that personal mentorship role and still work in innovations through the University of South Alabama here, which I participate with NSF funded I-Corps program as a teaching team member, and through BioAlabama, and through our innovation incubator here through Innovation Portal. So I feel like this allows me all of the networking and all of the kind of boxes to tick each of the things that I like.
So it's very evident that you like what you're doing. Do you have one favorite thing about whatever, or being a professor?
Yes, definitely that mentorship role. So when people come into my office and we're not just talking about, didactic information, we're talking about career goals, where they see themselves, their 5-year plan, their 10-year plan, kind of what's worrying them about certain advances in their career, how we can reduce that worry, or go through plan A, plan B, and maybe plan C's with them. And it's fun to see them actually start to utilize some of that mentorship information in the form of internships, and see them really start enjoying kind of the beginning of their careers. It's been really fulfilling to me, because this is really ground zero, this is where everything starts for them. So to help them through that and to watch them succeed is a very fulfilling thing.
Yeah, that really is incredible, and I might have to utilize your services at some point.
Yeah, sure. I enjoy it. It's really fun for me.
Now, what has been a challenge that you had to overcome, or potentially one that you didn't see coming?
Challenges. Well, as far as a career path in general, it was really changing that mindset from where I always saw myself, to what really worked best for me in my lifestyle, because those two things are not always the same. And really I guess something I didn't see coming would be that incremental steps really snowball into big effects, because when you're going through those little incremental steps or the pivots, you don't really think, you kind of feel more like, oh, I don't know what I'm doing. I don't know if I'm going to like this. Like, you get worried and you really think, oh, I'm never going to find a place to fit because I keep changing my mind. I can't think of anything solid. But ultimately, even just all of those experiences together really showed me that through experiencing multiple things, you really find your niche, and all of those incremental pivots really lead you to where you need to go. And it was really surprising to me. I know you can hear people say it, like, the journeys half the battle, like all that stuff, but really experiencing it was a game changer for me, or an eye opener. And I didn't expect it to really hit me like as such. I expected, because when you're going through your undergrad degree, you're like, okay, I'm going to get a degree and then I'm going to utilize it. So, and I'm going to utilize it in this very direct way. but that's typically not how it happens. And that's really where I enjoy hearing people's plans. And then I love hearing their stories of what actually happens in real life and how they and where they are and how they got there. So that really, like I said, that was something I didn't anticipate for myself. But now that I have, it's the biggest thing I enjoy talking about with other people. So so it was a big challenge for me to really change that mindset and accept those incremental changes were for my betterment.
I know you spoke a little bit about how you got into the role that you're in today. Can you speak a little bit more on your academic journey, like specifically undergrad through PhD?
Yes. So my bachelor's, I got it from Spring Hill College in Mobile, Alabama. It's another small Christian school. And it was in biology with a concentration in pre-health. And I had a minor in biochemistry. And then during that time, I started working in a clinical laboratory here within a hospital. And I realized I really liked the lab. And this is part of that incremental change and the challenges. I was set on pre-med and I was like, I'm going to go to med school. Then I worked in a lab for 6 years, 5-6 years. And I ended up loving the lab and I loved lab work. And so I ended up talking to a guy at South who I didn't know who he was at the time, but it was one of my professors, my advisor from undergrad told me to talk to him because he was like, oh, he might have some lab work for you to do. And I had taken a year off in between undergrad and grad school because I didn't know where I wanted to go for grad school. I was like, do I, everything seemed such like a big step. I wasn't sure. And so I went and talked to this guy. He might have some lab work for me for research purposes. So going from clinical to research. Well, it turns out that he was the head of the PhD program at South. And he asked me if I wanted a PhD. So I was like, okay, I'm not currently enrolled in graduate school and I don't know. I don't have big plans for grad school this year. So sure, why not? I'm, early 20s and it's interesting. So sure. So like the next week I took the GRE and the next week I was accepted and then got all of my paperwork to start in the fall. And that was like January, February timeframe. And literally I was enrolled in August. So I ended up getting my PhD in pharmacology and it's basic medical science, but my department was pharmacology and internal medicine. So, and Center for Lung Biology. So I concentrated on infectious disease modeling of the lung in animals. And then I used that model. I took it to Mitchell Cancer Institute here, which is, it's an academic institution, but it kind of operates like a small, or it used to operate like a small biotech at the time because they had a lot of private funding and I did a lot of therapeutic development. And they needed, at the time when I graduated, they didn't have any models of lung tumors. So I was like, well, I made a model of infectious disease in the lungs. So let's try for tumors. and so I worked in the drug discovery lab and I made the model for various types of tumors, metastatic and non-metastatic or primary tumors. And then we tested a bunch of drugs made in-house against those tumors. And then that led me back to, okay, I really, incremental steps again, I realized I really did not like cancer. It's very molecular. It wasn't for me. I was more of a physiology, histology type person. So I thought, okay, I want to go back to infectious disease. Well, lo and behold, South got like a $3 million grant to build a laboratory of infectious disease, and they needed to fill it with people. So I was the first postdoc in the laboratory of infectious disease. And I actually worked in a virology lab, which I had worked with bacteria before. But so I got that virology experience. I got a lot of experience with kind of compliance, CDC regulations, and just really all of those regulatory affairs stuff. So it really got me interested in policy. And through development of a model and commercialization of that model and development of therapeutics and vaccines, I was interested in policy as well, because those were always kind of not hindrances to commercialization, but certain hoops I had to jump through and really focus on and learn about, because, as a student, I didn't think about FDA regulations or, things like that. So this really forced me to think of that. And I still really like it, because that's a lot of really satisfying paperwork on my end. And I enjoyed that. So then when I finished my second postdoc, I was like, oh, I don't know if I'm ready to move away from Mobile. So that's when I took my first actual job outside of my training, which was for marketing and licensing.
Was there a specific reason why you wanted to get into bioscience in the first place, like before you even got to college?
Yeah. So, well, if you talk before I got to college, really it was just science in general was interesting to me. So I actually grew up on a farm. So experiencing my outside world and all of the stuff that comes along with living on a farm, kind of leads to a lot of, I feel like, inquisitive science related questions. So it was really always, my family was always like an agricultural scientific family, and they were always very upfront and blunt with scientific explanations. And a lot of people have to be in that kind of scenario, because it's like, okay, don't mess with this because X, Y, or Z, or you need to handle this in a very specific way. So it was always part of my lifestyle, and it just was something that I grew really to love, like that. In that questioning of the outside world and my experiences really led me to science before I even knew what different science roles were, and my different opportunities that would be given to me.
Yeah, that's fascinating. I know I personally am always asking, like, why do things work? That's why I got into physics in the first place, because I was like, physics is the foundation of all other knowledge. It's,
Yeah, that's what I was really interested in engineering as well when I got into the marketing role, because I had just focused on bioscience for so long. So opening up to that world of engineering, I was like, oh yeah, this is actually making certain bioscience things applicable in, like, through mechanical engineering, and all of this device development was really, really interesting to me. So, and it was like, okay, how did you make that work? How did you put that together?
Yeah.
So it's just very, I think most scientists have really naturally inquisitive personalities, and most higher education people, period, have very inquisitive personalities, and it suits us well.
All right, well, I've got 2 wrap-up questions for you. So the first one is, as you reflect on your personal and professional journey, what is one of the biggest lessons that you learned that shaped who you are today?
Yeah. So I guess I kind of touched on that, is really focusing on incremental change. And it was very hard for me, because I'm very much a impatient person and a big picture person. So really focusing on small pivots and small changes, and taking the time to really acknowledge how they were directing me was a really big thing. And then that's kind of my big advice to mentors now, is really taking the time to accept that things may not always be what they seem, or your overall dream may not become ultimately your reality, but there's a reason for that. And there are multiple opportunities out there aside from just, okay, I have a degree in microbiology, so I'm going to go be a microbiologist. Like, it's never that cut and dry. So, I mean, you can have a degree in microbiology and then you can write science policy. So it's really accepting all of these changes for yourself and how they apply to your overall satisfaction with yourself and your career.